welcome everyone to another AOH webinar. Today's webinar is titled Managing Exposure to RCS Across Australian Workplaces, Experiences of Occupational Hygienists in Silicosis Prevention. And our speaker today is Kate Cole. As you all know, Kate is the current president of the AOH. Before we officially start, I would like to make an acknowledgement to country. So in the spirit of recognition, the Australian Institute of Occupational Hygienists acknowledges the traditional custodians of country throughout Australia and their connections to land, sea and community. We pay our respects to their elders, past and present and emerging, and extend that respect to all Aboriginal and Torres Strait Islander peoples today. So to introduce our speaker, Kate, I think most of you know Kate, but we'll read her bio for you. Our speaker today is Kate Cole. She is an engineer and certified occupational hygienist with a key focus on the prevention of silicosis, informed through the completion of a Winston Churchill Fellowship and her work across major construction and tunnelling projects, both in Australia and internationally. She was named by the Australian Financial Review as one of the top 100 women of influence for her work in crystalline silica dust control, and as one of Science and Technology Australia's superstars of STEM. For her service to workplace health and safety, Kate was awarded a Medal of the Order of Australia and included in the COVID-19 honour roll in the 2022 Australia Day Honours. Kate is the co-chair of the Lung Foundation National Silicosis Prevention Strategy Expert Steering Committee and is current president of the Australian Institute of Occupational Hygienists. And we thank you, Kate, for sharing with us today the findings from this very interesting survey. So before I pass over to you to give us the presentation, we do have a function for our attendees today to ask questions via the Q&A. So down the bottom of your screen, you'll see a Q&A button. If you have questions for Kate, can you please type them into the Q&A? At the end of the session, I will host a Q&A with Kate and read out those questions that you've included, and we'll get through as many as we can in the time period. There is, of course, a chat function as well, so feel free to chat with each other in an informal way on that chat function, but put your questions in the Q&A tab. So over to you, Kate.
Excellent. So thanks very much, Kelly, and it's a delight to be here. I'm just going to share my screen if I can. One moment. So hopefully you can all see that. Look, I'm really excited to present the results of this survey this morning. It's been a lot of work by the AIOH External Affairs Committee, and I think it holds a lot of really great information. But I'm going to start with a bit of a background as to why we're even talking about what we're talking about today. A National Dust Disease Task Force was established back in 2019 to address the re-emergence of silicosis. And when that task force handed down its recommendations last year, it included specific regulatory and non-regulatory actions designed to have an impact on improving worker health and safety. In January this year, Safe Work Australia announced its intention to undertake economic analysis and stakeholder consultation to support a regulatory impact analysis of regulatory and non-regulatory options to manage risks associated with silica dust exposure in Australian workplaces. And the Australian government's response, which is shown on the right, to that task force report tabled in March of this year, acknowledge those recommendations and the work of Safe Work Australia in conducting that regulatory impact analysis to evaluate costs and benefits of changes to health and safety regulations. So as occupational hygienists, and I know we have a few non-OC hygienists on the webinar today, so just for context, we routinely work in and attend workplaces where silica dust presents a significant risk to health. We undertake health risk assessments, we measure the level of silica dust exposure, we check and verify if safeguards put in place to protect workers are indeed in place, and if they're working, we make recommendations for control measures to protect workers, we provide training and education in silica dust awareness and management, We consult with workers about the tasks that they're performing, and we gain their understanding about that level of exposure. And we report on these findings and provide recommendations to employers to both comply with the relevant legislation and to keep workers safe. So the insight of occupational hygienists about what is happening on the ground, in addition to the attitudes of management and the level of priority placed on protecting the health of workers, provides a really unique and a valuable perspective. But although occupational hygienists have first-hand experience of the current management of silica dust exposure across Australian workplaces, there's a scarcity of available information on how effectively silica dust exposure has been controlled across the country. But this information is absolutely vital to understand the potential effectiveness of any future regulatory or non-regulatory option or intervention. So to support the regulatory impact analysis, the AIOH External Affairs Committee developed a survey to gauge the expertise of occupational hygienists on the front lines on the management of exposure to silica dust and the prevention of silicosis in Australian workplaces. And that's what I'm going to share with you this morning. So I'll start with the materials and the methods, how we did it. A series of questions were developed by members of the External Affairs Committee of the AIOH. We are very fortunate to have such experienced members contribute their time to this. For those that are not aware, the members of the External Affairs Committee are Professor Dino Pistaniello, Associate Professor Deborah Glass, Peter Knott, Shelley Rowett, Dr. Sharon Johnson AM, and Tracy Bentz, our AIOH President-elect. The survey was anonymous. It was hosted on the platform menti.com. Although it was promoted through social media, emails, and our AIOH annual conference, all the links went back to our website, but it was only accessible through the members portal to complete it. It was anonymous in nature. It was open for 4 weeks up to the middle of April, and we aggregated all information, so we cannot tell individual responses from particular members, for example. So we had 105 occupational hygienists complete the survey from around the country. 96% of them were from one of the professional membership grades, which was great because it provided a really high response rate from qualified and experienced occupational hygienists. The majority of respondents were from New South Wales, closely followed by Queensland, then Victoria and WA. And we had relatively small participation, but still participation from South Australia, Tassie, the ACT and the Northern Territory. A bit more on demographics. In the top left-hand yellow chart, you can see that the majority of responses were from full and fellow members of the Institute. And for those not familiar with our professional membership grade system, provisional membership is the first of the professional membership grades within the AIOH. So those members have completed relevant tertiary studies and have been working in the field of occupational hygiene or one of its specialist branches for at least 1 year in a professional capacity. Whereas full members, in addition to completing relevant tertiary studies, have been working in the field of hygiene or its specialist branches for more than 5 years in a professional capacity. And fellow members, it's more than 15 years. And those members have also made a really distinguished contribution to the advancement of our profession. So around 94% of respondents had more than 6 years experience in occupational hygiene, and around 58% had more than 16 years experience. So that was great, a great response for us. We did ask how many samples of silica dust exposure that participants had collected in 2021, appreciating it was a bit of a lockdown year for some of us. But more than half of the respondents replied that they had collected at least 50 samples, and around a third collected more than 100 samples that year. The collective experience of everyone that responded represented at least 7,645 samples of silica dust exposure, which was great. And the chart on the bottom right shows the different industry sectors where occupational hygienists nominated that they had experience. So you can see that around 50% of respondents had experience in engineered stone, Almost 70% had experience in construction and or tunnelling, and almost 90% in mining or quarrying. So onto the results. So we asked occupational hygienists about their level of concern regarding overexposure to silica dust in Australian workplaces. We used a scale 1 to 5, 1 was not concerned and 5 indicating extremely concerned. So 71% of responses selected either 4 or 5. No one selected not concerned, and this confirms that it is entirely appropriate for us to be focusing and continue to focus on this very important issue. Hygienists were asked of their experience of the level of awareness by employers on the risk of exposure to silica dust across the 3 main industry sectors that we had highlighted in the survey. So this chart shows that the highest level of awareness was reported in the mining and quarrying industry, and that's shown in the grey, followed by the construction and or tunnelling industry, which is shown in the yellowy orange. And then lastly, by comparison, in the engineered stone industry, which is shown in the blue. So not surprisingly, I guess, engineered stone, that industry sector is small. It's a very different makeup to the types of employers that engage in construction, tunnelling and mining. And I guess, it's unfortunate, but not surprising that the level of employer awareness was the lowest in the engineered stone sector. So one of the proposed options within the regulatory impact analysis that we're aware of is a non-regulatory option that focuses on awareness and behaviour change initiatives. So in this survey, we asked how effective these initiatives have been at reducing exposures to silica dust across the 3 different industry sectors. And the survey showed that behaviour change initiatives appeared to be the most effective by comparison in the mining and quarrying industry, followed by engineered stone, and lastly in the construction and tunnelling industry. But most concerningly here, we still had a large range of responses that said never, seldom, or sometimes. Occupational hygienists were then asked a range of questions around air monitoring of silica dust across the different industry sectors. And here's the responses received when we asked if air monitoring was undertaken appropriately to assess silica dust exposure. A similar pattern of maturity emerged with higher results received by the mining and quarrying industry. This was then followed by construction and tunnelling, and followed lastly by the engineered stone industry. But again, most concerning here was the high number of seldom or sometimes responses. For context, for the non-occupational hygienists listening to this webinar, air monitoring for silica dust is the only way to tell if employers are complying with the workplace exposure standard or legislative limit for silica dust. Because silica dust is invisible to the naked eye, you can't see it in the air. The only way you know how much workers are being exposed to is through air monitoring. So when it came to the frequency of personal air monitoring being done, it was concerning to see that a significant number of occupational hygienists reported that personal air monitoring was being undertaken sporadically with no set frequency. Most commonly across construction and tunnelling and in the engineered stone industry. By comparison, in mining, we can see that the frequencies seem to be pretty defined, either annually, twice per year, or monthly, as we would anticipate. So we asked questions around how often real-time dust monitoring was used to support risk assessment or control in industry. And just for context of the photographs, the top photograph is of a personal sampling personal sampling pump, and that's what occupational hygienists use to measure silica dust exposure to workers to compare against the workplace exposure standard. And the bottom left is a real-time dust monitoring device. So I mentioned before that personal air monitoring is the way that employers use to demonstrate compliance, but real-time dust monitoring devices are really useful because they help us as occupational hygienists understand peak exposures, and they help employers understand what control measures might be needed for specific tasks. So real-time respirable dust monitoring displays instantaneous results, whereas personal exposure monitoring may take a week or a couple of weeks to get the result back. When the proportion or the amount of quartz or silica in the dust is known, or it can be estimated, real-time monitoring is a really useful indicator of silica dust exposure in the workplace. The frequency that real-time monitoring was occurring across different industries formed part of this survey. Concerningly, around 2/3 of respondents said that manufactured stone workplaces either seldom or never use this type of technology. But again, by comparison, we saw more uptake in the mature sectors like construction and mining. Last year, the AIOH and the National Association of Testing Authorities, or NATA, collectively documented our concerns around the measurability of silica dust at concentrations below 0.05 milligrams per cubic metre, or the workplace exposure standard. So those concerns related to the level of uncertainty associated with measuring compliance to a workplace exposure standard below that concentration. And one strategy of potentially overcoming limitations associated with uncertainty when quartz concentrations are able to be accurately determined is to use the weight of respirable dust from exposure measurements to determine exposure and apply that percentage of quartz to the measured value to estimate silica dust exposure. So to understand the appetite of hygienists to use this strategy, we asked hygienists how confident they would be in using the weight of respirable dust from personal exposure measurements as a proxy for silica dust when high silica content engineered stone dust was being generated. And as you can see, the majority of participants were not confident in using that strategy. Occupational hygienists noted that non-compliances or exceedances of the workplace exposure standard occur across many sectors. Hygienists were asked about their experience with the level of compliance, and the most common response received across all industries was that some of the exposures exceeded the workplace exposure standard, and there is potential for higher exposures. So this demonstrates that current compliance with the workplace exposure standard is less than optimum, and we have much opportunity to improve. The National Dust Disease Task Force identified a number of significant concerns with the existing work health and safety protections, regulatory protections for workers. And one of those was that government interventions appeared to have been inconsistently implemented and monitored. And at the AIOH, we have noted in previous public submissions that there has been a failure by regulatory agencies to enforce their own legislation. But to gauge the effectiveness of compliance activities, we asked occupational hygienists of their experiences across different industry sectors. Concerningly, occupational hygienists were consistent in their highest response, with the effectiveness being somewhat effective, selected across all industry sectors. Responses indicated a more effective level slightly of intervention in the mining and engineered stone industry, but still the most common response by far was somewhat effective. When we delved down across the different states, there didn't appear to be a significant difference in the level of effectiveness within each of the states or territories, suggesting that the issue wasn't isolated to one particular jurisdiction. I have included South Australia here, but I will note that the level of response, the response rate from South Australia was very, very small by comparison. So it really wasn't possible to say that one state was outperforming another one. It seemed to be relatively consistent. We asked occupational hygienists what they viewed their top 3 barriers were to the prevention of silica-related disease. The top was a lack of management commitment, followed by a lack of financial resources for employers to bring in controls, and the third being low compliance with existing regulations. Other barriers included a lack of training, a lack of awareness, a lack of silica dust specific regulations, and a lack of competence of people undertaking air monitoring and providing advice. More came out later on, I'll explain in the presentation from the free text responses, but there was quite a lot of commentary around employers going to the lowest cost option and not necessarily using someone that was competent and qualified to undertake air monitoring and provide appropriate advice. As 3 of the regulatory impact analysis options proposed were regulatory in nature, survey participants were asked what they thought the top 3 most effective preventative strategies were from a regulatory perspective. And this chart shows the responses selected in order of priority from left to right. Number 1 that we got back was specialist inspectors with detailed knowledge of silica dust assessment and control. Second was the mandatory reporting of exposure exceedances. So for context, if a hygienist collects a sample for silica dust exposure and that result is above the workplace exposure standard, in many industries that are outside of mining, that result doesn't go anywhere. And thirdly, the third most effective regulatory preventative strategy nominated was awareness and education programs. So we had a lot of free text responses, and we broadly categorized them into 8 key areas. The first was a broader prevention strategy. So occupational hygienists noted poor compliance with basic control measures and air monitoring, but also with basic health monitoring. And this showed the need for a national preventative focus, bringing together occupational hygienists, medical professionals, and regulators all working towards that same end goal. The second was a federally coordinated response. So hygienists noted that the federal government needed to be engaged and have a clear plan of how silicosis would be prevented in Australia with a consistent approach to silica exposure control across all industry sectors. The third was improved regulation. So many people nominated that more prescriptive regulations were needed that set out a practical and a pragmatic approach. Hygienists noted the need to move towards control measures and focusing there and control verification, and that regulators needed to work with industry to include specific control strategies into the legislation. Hygienists noted the need for air monitoring to be specifically legislated for silica dust in industries where that isn't done already, and that it's so incredibly necessary for the occupational hygienist to document the tasks carried out during air monitoring and provide specific recommendations and not just general words around increasing ventilation, for example. The fourth was a focus on compliance. So the strongest theme related to the need of increased enforcement by the inspectorate, aided by specialist resources undertaking more inspections across all at-risk sectors. Increased compliance needed to be extended to control measures and air monitoring and health monitoring activities. And respondents also highlighted that subcontractors really needed to be a key area of focus for compliance inspections. The fifth area was a focus on the source of exposure. So hygienists wanted more to be done to eliminate or reduce the amount of quartz in source products and more focus on the suppliers' product stewardship obligations. There was also a lot of commentary about it, not just acknowledging the hazard of the source, but also acknowledging the increased toxicity of freshly fractured crystalline silica in some industries. Number 6 was respiratory disease monitoring. So there was a strong need for a national respiratory diseases database with mandatory reporting by the diagnosing doctor, which would enable tracking of silicosis trends in the population and early identification of new outbreaks. We heard that health monitoring needed to track respiratory health over the lifetime, as silicosis may only become evident after the worker has left the workplace. Number 7 was improved training and awareness. So Hygienists noted the need to improve the awareness of young workers through mandatory silica dust awareness training for employees in industries with silica dust exposure, and noted that that may be also outside of the industries sectors that were included in this survey. It was recommended that specific roles and activities that are at high risk were more widely publicised, and those particular roles needed that training, and more information was needed on what good control or what good looks like. And lastly, around technology, hygienists acknowledged the need to validate and encourage the use of direct reading devices for continuous monitoring, whether that's respirable dust or real-time respirable crystalline silica monitoring, either or, and to find a way to actually use that for some type of compliance purpose. And hygienists also identified the need for financial assistance and funding to improve the measurability of silica dust. So in summary, this work represents the first survey of occupational hygienists and their knowledge on the management of respirable crystalline silica in Australian workplaces, which was initially designed to support the regulatory impact analysis process, which is being led by Safe Work Australia. We understand that there was 4 draft options within that regulatory impact analysis, which is shown in blue on the screen. The first was, keeping the status quo. The second was non-regulatory, so implementing awareness and behaviour change initiatives. The third was implementing a national licensing framework. And the fourth broadly was the regulation of defined high-risk crystalline silica processes for all silica-containing materials. So this survey clearly highlights that the majority of occupational hygienists in Australia are concerned about the overexposure of workers to silica dust. And with the exception of the mining and quarrying sector, the basic process of air monitoring is likely inadequate most of the time. Concerningly, approximately 20% of respondents in the engineered stone and the construction and tunnelling industries reported that air monitoring is seldom undertaken appropriately to assess exposure to silica dust, and where it is, that compliance is suboptimum. The level of awareness by employers on the risks of exposure to silica dust was the highest in the mining and quarrying industry. This is likely not surprising. The mining industry has a long history with pneumoconiosis and management of such, recently brought into the spotlight through cases of coal workers' pneumoconiosis or black lung. The mining sector is dominated by large multinational companies which employ health and safety teams, professionals, occupational hygienists. And by contrast, artificial stone benchtop manufacturing is carried out by small enterprises, micro-sized workplaces, and evidently have little or no understanding of the risks. There was a disparity in the effectiveness of initiatives to reduce exposure to silica dust across different industry sectors. And given that 2 of the top barriers to improved exposure control were reported to be a lack of management commitment and a lack of financial resources, it's unlikely that behavioural change initiatives would be effective unless specifically required by regulation. There was also disparity across the sectors when looking at the adequacy of air monitoring, the frequency of air monitoring, and the use of real-time dust monitoring, which highlights an inconsistent approach to protecting worker health across each of the industries. Occupational hygienists generally reported that regulatory intervention on silica dust was only somewhat effective, and the barriers reported and free text comments provided suggested that further work in the area of compliance and enforcement is greatly needed. A greater focus on compliance with regulations was a really strong theme, and further to this, occupational hygienists felt that when overexposures to workers do occur, that reporting of that needs to be mandatory. At present, there seems to be very few, if any, consequences for when employers expose their workers above the workplace exposure standard in industries where reporting is not already mandatory. So in conclusion, hygienists report that Australian workers are being overexposed to respirable crystalline silica, and this is cause for concern. We need to move away from the status quo towards a strategy of increased focus on controlling exposure, measuring control effectiveness, reporting of overexposures, and increased enforcement to ensure compliance with the workplace exposure standard and to protect workers. We need a national and consistent approach to silica dust exposure across all industrial sectors. And the experiences of occupational hygienists support the need for a regulatory strategy with an increased focus on controlling and measuring exposure. Silicosis is an irreversible lung disease, but it can be entirely prevented. But we do need to have a greater focus on exposure control through regulatory and educational interventions. And I think it's really important that we need to understand that the lack of control in workplaces, the impacts are not just felt there. The lack of control in workplaces results in a cost shifting of the burden of occupational lung disease onto those individuals and to the public health system. So this is not just a workplace issue, this is a societal issue, and one that will rely on national leadership and coordination to solve. So just wrapping up, I really would love to acknowledge the fantastic work of the AIOH External Affairs Committee, who have worked hard over the past few months to develop the survey, to go through all the information and to draft the information that I'm presenting to you today. And I thank them for all of their efforts. And I'm very happy to take any and all questions that anyone may have. Thank you.
Thanks, Kate. Excellent summary of the survey and some very interesting findings. We haven't got any questions typed into the Q&A section just yet, but I have two questions for you. First of all, what are the plans in terms of disseminating the findings from the survey? So what are you thinking of doing with the results?
So because we want to support the work of Safe Work Australia, because we appreciate how valuable it is, we will be documenting and providing all of the detail that we've obtained from the survey and providing that to Safe Work Australia to inform their regulatory impact analysis. We also hope to publish this data as a commentary for wider distribution after it's been provided to Safe Work Australia.
Excellent. Have we got timeframes on when you're planning on having these things happen, Kate?
We should be able to provide the information to Safe Work Australia during the consultation period of the regulatory impact analysis, which I understand will be coming out within a number of weeks. I apologise, I don't know the exact date and the update from Safe Work Australia on when, but when it does come out, we will be ready to provide that information. And with regards to publishing, we all know that that's not necessarily within our own control, but we will have the information ready to go out within a number of weeks.
Okay, so while you've been answering those questions, we've had two questions popped into the Q&A. So Mark is asking, do we have plans for more media coverage? I've been very excited to see previous TV presentations, etc. I think a lot more is needed.
Thanks, Mark. I think, for us within the AIOH, it's great to be featured in the media and to have a voice, but it has to be really relevant. It's not about just being on TV, it's about contributing to that debate and having something to say. And I think within the Institute, we have been fortunate to have a platform and to be very vocal on issues that are important to worker health, and this is absolutely one of them. For us, it's about really supporting and helping both federal and state bodies that are leading this work in the best way that we can. And we're very fortunate to have a seat at the table with the Lung Foundation's Expert Steering Committee and the great work there and the work that's been happening at Safe Work Australia. So we'll continue to contribute through those channels primarily. I guess that's the focus at the moment.
Okay, thanks, Kate. Grace is thanking you for your presentation And she's asking, how do you think we can keep these big mining companies accountable other than implementing stricter regulations or legislation or fines?
Well, by comparison, based on the survey, mining's actually performing pretty well in comparison to construction, tunneling, and engineered stone. So I think the crux of the question comes from how to keep people accountable. And one of the largest themes from this survey was increased compliance and enforcement by a well-resourced regulator with specialist resources with knowledge in occupational hygiene. So it's one thing to attend a workplace, and it's another thing to have a specialist professional attend a workplace and know what to look for. And that's a huge theme in this survey, is that occupational hygienists feel there needs to be more proactive compliance and enforcement done by the relevant or respective jurisdictional regulator to that industry. So I think that's really the key. It's one thing to bring in new regulation, but that's words on a page. It can only be effective if we're resourcing our inspectorate appropriately to be able to both support and enforce compliance wherever it needs to be improved.
Thanks, Kate. Jay Barnes is asking whether the data was able to indicate if there was greater awareness for RCS in Queensland for the artificial stone industry relative to other states.
That's a good question. I'm happy to take that on notice. One of the challenges that we had was a response rate of the numbers that we had within each one of the states. So whilst we might be able to do that comparison, I don't know if we'd be able to say that it was statistically significantly higher or lower. Only around 50% of participants, so that's 50 people across the country, had experience within engineered stone. And when you start to break that down within each of the states, you get quite low numbers. But I'm happy to take it on notice.
Thanks, Kate. Tracy Bence is asking if you could speak to the attendees today about what resources might be available from the AOH or other areas that are ready to go now to help employers with meeting the challenge of controlling RCS dust exposure in their businesses.
Great question, Tracy. Thank you for the reminder. I think a fantastic resource is to go to the Breathe Freely website, Breathe Freely Australia. There is a lot of information and resources freely accessible for employers and workers within the mining, construction and engineered stone sector, freely able to be downloaded and used and implemented to protect workers in those sectors. And there's a lot of people that should be really proud at the AIOH for the work that's gone into providing those resources, because it definitely fills a much needed gap to help and support workers and employers in those high risk sectors.
Thanks, Kate. Yasmin is asking, well, first of all, she's thanking you for your presentation and asking, as real-time monitoring is encouraged in all industries, do you have any recommendations for the types of real-time monitors available that can be used specifically for use in underground mining? So a bit of a technical question.
So I can't recommend anyone specifically because that wouldn't be appropriate. I think the best answer for that would be to reach out to your certified occupational hygienist to look at what's relevant for your specific area. Look, I think what's been really great is within my lifetime, I've seen the uptake of real-time dust monitoring coupled with video exposure monitoring. So using a little GoPro camera to actually look at dust concentrations and what tasks a worker might be doing, not for surveillance purposes, but just to understand where really high peaks of exposure can occur. And one really simple example from my own industry is that when we're looking at workers that are in heavy plants, so whether it's in an underground mine or it's in a construction site and they're in an enclosed cabin of an excavator or a articulated dump truck, for example, we may assume that dust is coming in from the windows, or we may assume that dust is coming in from the floor. But because silica dust is invisible, respirable dust is invisible, these are all just assumptions. It's not until you start to use real-time dust monitoring devices that, for example, I've seen that it's actually the fabric in the seat that was causing these really peaks of exposure. So simply by putting plastic covers over those seats or replacing fabric and using leather seats to prevent that dust building up in the seat, so every time the worker sits down, they're not getting that huge spike of exposure. That's a relatively inexpensive control to put in to prevent exposure to silica dust. And if we didn't know that, we might be trying to spend thousands of dollars on redesigning these cabins or the air conditioning system without really understanding where the peak level of exposure is coming from.
That's an excellent example, Kate. We do have someone in the chat asking if we can provide the website for the Breathe Freely resources. So I think I'll, when you're answering the next question, I'll try and put that into the chat or before we finish the session.
No problem.
Actually, someone's done that for me. Thank you, Tracy. I've just seen you pop that into the chat, so that's great. Our next question is from Warren. He thanks you for your presentation, and he wonders if you think we need a federal organisation similar to NIOSH to continue to monitor and prevent occupational diseases.
So I think if we didn't know that we already needed an NIOSH because we've been working in hazardous industries for so long and it's been relatively uncoordinated, you can definitely see that we need one as a result of the management of the pandemic. So absolutely, we need a model that is federal, and we need it to be coordinated and something similar to NIOSH. I don't think it's as simple as applying something in another country and adopting it here in Australia, but we definitely need something to fill that gap. And it's not just around the protection of workers from silicosis, it's the protection of workers from COVID and other infectious diseases and other chemical, biological, physical hazards. But we've also seen the gaps with really simple things around respiratory protection. We know in the US it's really easy to go on the NIOSH website and see what types of respiratory protection are approved or compliant, and that's a huge gap in Australia. Because we don't have that, we had all of these non-compliant respiratory protective devices entering our market and being used for COVID. And unfortunately, those non-compliant respirators started to make their way into these high-risk industries like mining, construction, and engineered stone. And when we do have employers relying on respirators to protect workers, and those respirators are non-compliant, you know, these are massive risks that we have as a country that we absolutely need to address. So I'm wholeheartedly in support of a federal Centre for Disease Prevention and Control type model.
Thanks, Kate. Another question. I think we haven't got the person's name, but they're identified as a trainer. Is there any consideration around informing trade education institutions? Perhaps one of the ways we can help impact some of these smaller businesses is education of new incoming tradies.
Yeah, absolutely. Look, recently, I know there is at least one nationally endorsed course on silica dust awareness, which the AIOH has endorsed that content and is really, really good. I know that there's another one potentially coming out in the future. I think we need to get a nationally coordinated approach to training. So as an example, you know, in construction, when you go and get your white card, they don't talk about silica dust. When you go and work in these industries, there's no mandatory training that workers are provided with to help them understand the risks of entering these industries, but more importantly, the steps that they can take to keep themselves safe and what should be there to keep themselves safe. And unless we're equipping our workers, which are our best asset in our country, then we're really setting them up to fail. So we have in the Institute been doing a lot of work around those nationally accredited courses, primarily aimed at workers, because we do appreciate just how important it is to get the right information to those that the ones that we're here to protect.
Mm. Thanks, Kate. Dean is asking if you think the performance of the mining sector is due to the more prescriptive regulation in that sector. Well, it wasn't a specific question of the survey, so I'm just
extrapolating information and guessing. But my informed guess would be yes. So within the mining sector, there are more prescriptive regulations, as we know, and there's also requirements for the mandatory reporting of exceedances. And what gets measured gets done. If a company is required to report exceedances and there is action as a result, then arguably you would have a much better outcome. Conversely, we have huge sectors that, yes, under the regulation, there's still a requirement to do air monitoring, but it's not prescriptive. It requires a competent person who's familiar with regulation to really break it down for employers, sometimes to explain it. And even if they do exceed the workplace exposure standard, that data just goes back to the employer and the workers. And if workers have not been provided any training or education about what that means, what do they do with that information? If you're being provided a report with numbers that say milligrams per cubic meter, what does that mean to you if you haven't been provided that context? So I think it is a huge gap. And we can see clearly from the information from the survey that occupational hygienists want more prescriptive regulation to make it clearer, to arguably improve the health outcomes that we have at the moment.
Crystal is asking, well, first she's commenting that it's surprising that air monitoring isn't mandatory. So this is along similar lines to what you've just been talking about. But what do you think it will take for regulatory bodies to get on board? I'm assuming Crystal's asking what needs to happen to make monitoring mandatory in other sectors.
Well, it's not that it's not mandatory. So if there's a significant risk, then there has to be monitoring being undertaken. But the way it's worded, it's not necessarily as prescriptive as you would find it in some industries like mining, for example. So I think what needs to happen is that we need to go through this regulatory impact analysis process and support Safe Work Australia in doing that. Regulation is not in our area; it's in the area of Safe Work and the jurisdictional regulators, and just provide that information that if you want to have a better outcome, then we really need to address these key areas. Otherwise, we are just going to still be talking about this in 50 years' time. And if I just digress for a moment, if we look back into our history of silicosis in this country, the things that I have presented to you in this survey today, if we had asked occupational hygienists back in the 1960s and the 1970s, the 1980s, they were saying very similar things. If we look back at the first pneumoconiosis conference or the second pneumoconiosis conference in Australia, which is I think in 1978, like these same things, these same themes are coming through. So unless we do address them, we will just be talking about the same thing, and workers will continue to be exposed and workers will continue to have silicosis, which is completely unacceptable in 2022.
And I think obviously that's an important role for our professional institution, and you're doing a fantastic job, Kate, in leading change in this area. So let's hope that we can keep seeing improvements. We've got a question from Richard. Are we going to see an update to AOH's position paper on RCS? The 2018 document references the old exposure standards, so it would be great to see an update, a formal update with the changes in the industry.
Yep. So I have no immediate plans. I'm happy to take that on notice with the chair of our Workplace Exposure Assessment Committee. There is a lot of other things happening in this space, not just the position paper, but also guidance around reducing uncertainty with regards to measurement, which is really important. We recognise the challenges around measuring respirable crystalline silica at levels below the workplace exposure standard, particularly when we have extended shifts. So for context, for non-hygienists, the more hours you work, if it's more than 8 hours a day, which is most industries, and if it's more than 40 hours a week, again, most industries, then that number of the workplace exposure standard actually gets lower. So when we're talking about measuring silica dust to comply with the workplace exposure standard, we're not just talking about 0.04 milligrams per cubic meter, we're talking about 0.01 and 0.02, very, very low levels. We appreciate that there's things that can be done to reduce that uncertainty in the field. So we're working through guidance to assist occupational hygienists and I guess in the general awareness of such across our industry.
Thanks, Kate. Anne Lumar asks, did respondents suggest specific regulatory training interventions?
So training of the regulator?
I'm not sure.
There was a lot of commentary around the need for specialist resources within the regulator, absolutely. Not so much training by the regulator, if that's where the question is going. I guess there was a lot of observation from hygienists that had been given improvement notices from an employer to say, I've got to address this and I've got to do A, B, C, and they're looking at it going, well, yeah, you've got an improvement notice around respiratory fit testing, but you don't have an improvement notice about not having any air monitoring, and you haven't done any air monitoring. So let's support you to get all the controls in place and do the air monitoring. So it's just an observation that potentially the items that are being picked up by the inspectorate, there's some gaps, and there needs to actually be a little bit more of a deep dive, because hygienists are finding more problems than necessarily being picked up during regulatory inspections.
Perhaps the question was also about maybe mandating training for workers on, I'm not sure what the intent was, but maybe regulating that we do training for workers and those exposed.
Absolutely, wholeheartedly support.
We've got a question. Have you heard of any funding for national or state government to help with the cost of sampling, industry-based shared pool of data rather than individuals being accountable? So some questions around paying for sampling and being able to get access to shared data for smaller industries, maybe.
No, I haven't heard of that. I have had some feedback as an occupational hygienist that air monitoring is expensive and that it's really difficult. And my standard response is that's the cost of doing business in today's modern society. It's part of the regulation. So if you can't afford to comply with the work health and safety regulation, I would suggest you can't afford to be in business. And the cost of air monitoring, if we look at it, is so small and infinitesimal in comparison to the cost of non-compliance, a prosecution, or a worker unfortunately succumbing to silicosis as a result of an employer's actions. So I think you've got to put it into that perspective. The other part of it is, as certified occupational hygienists or occupational hygienists that work in these industries, we generally know or can anticipate the range of exposures depending on the types of tasks that are being performed. So we're not going in blind. So if an employer, for example, is cutting through concrete and not using any local exhaust extraction or using any dust suppression of any type, we probably don't need to spend money on monitoring. We need to spend time on intervention and controlling that exposure. Similarly, if there are interventions already put in place like LEV and dust suppression, we can anticipate the range of exposure that would likely fall into, and make sure that the worker is protected as an absolute priority, and then do air monitoring to check the effectiveness of such. So, we're not going in blind to these things. We, as a certified occupational hygienist, generally sharing our knowledge from other very large databases on silica dust exposure that exist internationally, which we have access to, but we don't have a localized pool of data outside of maybe what might be held in some of the larger consultancy areas sort of privately that I'm aware of.
Thanks, Kate. Stephanie has added her name to the questions. She was the trainer that asked the question about training for tradies. So thank you, Stephanie. And we have one last question, which is from Brad. Do you think employee medicals will become mandatory in other industries like they are for coal? And do you believe that medical data will improve regulation in these other industries?
I think it's incredibly important. We should have mandatory employee medicals that include, this is bigger than just silicosis, it should include audiometry and all those other things. to address the other health hazards that employees or workers are exposed to in these high-risk industries. Yes, they should be mandatory. You know, one would argue that health surveillance for crystalline silica is already a requirement in many of these sectors, but we've seen relatively poor compliance with health monitoring. And that all goes back to within the work health and safety legislative framework. If it's a significant risk, if silica dust exposure represents a significant risk, then health monitoring provisions apply and exposure or air monitoring provisions apply. But it relies on a competent person to assess that as a significant risk. So if we look at industries like demolition, we know as hygienists that silica dust exposure represents a significant risk, but we also anticipate that that's not being picked up in those projects. And we anticipate that there's a huge volume of workers that actually aren't getting health monitoring, let alone having the advantage of the control measures to keep them safe and air monitoring to check if those controls are adequate. So yes, we would like to see a standardized approach to medicals, which includes all the health surveillance requirements under the existing regulations. But further to that, we all know that regulation is state-based. And that does present a challenge, particularly for larger sectors like construction or tunnelling, where workers move from state to state because they have to pick up and do the same requirements every time they move from each state, and the data doesn't speak to each other. So if you do have a medical in New South Wales, it doesn't matter, have to go and have another one in Queensland, and they don't speak to each other. So we do need a national framework to improve the situation.
Fantastic, Kate. I think we've just got a couple of minutes left. So did you have any final comments you wanted to share before we wrap up this morning?
Look, I'd just like to say a really large thank you to every occupational hygienist who took the time to complete the survey. Within the AIOH, you would know that we always put submissions in when it's most appropriate for us to have a voice in these important issues that affect worker health and safety. And we have been doing that for some time. But this is the first year that we've gone, okay, well, we think we know, but we really want to understand what's actually happening on the ground. So I know it takes time to respond to our very large survey, and I know everyone's very busy. But what you have done is you've really helped us have more of an evidence-based or data-driven approach to advocating for the health and safety of workers. So I just wanted to thank everyone that took the time to participate and give us your feedback. It's greatly appreciated, and it will go a long way to helping improve the current situation for workers all across the country.